I'm going to present a project that we've done in Northumbria Healthcare Trust, which is where I've been working this year, as well as a O&G trainee in the northeast of England. So disposable healthcare is harming humans' health. And I'm going to tell you about rationalising the routine use of gowns and drapes in gynae theatre. So as I said, disposable healthcare is having human health impacts along its full life cycle. The factories where it's made is harming the people that work in the factories that you probably wouldn't want your family members or friends working in. These products are often petroleum-based plastics, and chemicals are added, endocrine disrupting chemicals are added to make them more flexible, to make them waterproof, to make them fire retardant. All these chemicals have been associated with significant impacts on especially women's health, male infertility, reduced IQ, cancers. The things that we use are then transported long distances across the world. So the gowns that we use in Northumbria are made in Thailand. They're used often for seconds, maybe minutes at the most, and then they're disposed of and incinerated. So the project that we worked on in Northumbria, I got the idea from when I went to the Green Surgery Conference in Birmingham last year. It was plastic surgeons, hand surgeons, realizing they didn't need to use full gowns and drapes for a lot of the procedures that they were doing. So I realized that we now actually in women's health do a lot of procedures in outpatients that we also traditionally have done in the theatre. So I made a list of all the things that we do under GA, but also do in outpatients. So particularly hysteroscopy, we do MyoSure, we do cystoscopy, Botox, Bulkamid. We also now do manual vacuum aspiration for management of miscarriage or termination of pregnancy, which was traditionally done more in theatre, and other smaller things like maybe Bartholin's abscess drainage or colposcopy and LETs, which sometimes you may occasionally do in theatre. And then we then collected the numbers of these that we do in theatre under general anaesthetic in a year, and that was 1,400. So we looked at what we use in the outpatients, which, as you can see, is minimal. We don't use gowns, we don't drape the patient. And in Northumbria, we use the disposable pack, the number that you can see at the top there. So I opened up the pack to see what was in it, and these were all the disposable items that we used. And then on the right, you can see the ones that we probably just need to use, or that we would use in outpatients. And actually, in outpatients for a hysteroscopy in Northumbria, they don't use a camera cover as well, so that would be an extra thing to get rid of. So calculating the weight per patient that we would save if we didn't use all this extra stuff, a gown and all these things in the pack that we don't need, was a kilogram per patient of weight, and £30 per patient. So calculating that total weight saved in a year was 1,500 kilos approximately, and up to £44,000. So in terms of challenges that you might have for trying to persuade people that actually we do things in outpatients without all this rigmarole that we do in theatre, is that obviously theatre staff are used to scrubbing. They find it quite uncomfortable if they don't wear a gown and drape, and also if we don't use gowns and drapes as well. But then you can say we're doing this in outpatients without all this, and we're not seeing an increase in infection rates. Where there isn't actually any data looking at infection rates between doing it in theatre or in outpatients. But anecdotally, we haven't seen anything. But that would be something that we could look at further. But I would say that most of these procedures, they're not sterile procedures. The camera of the hysteroscope is the only thing that really needs to be clean and sterile going in. Everything else doesn't need to be. The cost is helpful to persuade staff that it's important. I often find that they say, "Oh, well, I'm opening this pack anyway." But if you say, actually, we don't need most of this stuff in the pack. And other specialties, as I say, are doing it as well. Also, I think if you use the idea that actually it's not just about saving the planet, which I often say people think that's the main, obviously it's a driver, but actually the health harms of the endocrine disrupting chemicals and microplastics are significant. So what I'd say is that it reduces the first R of reduce, reuse, recycle. And actually, if we can stop using gowns and drapes when you don't need them, we can save a significant amount of money and also a significant amount of waste.